Good morning. We're here this morning with Shane Whitfield. Shane, you're from the Vulnerable Children's Group, is that right?
That's right, yeah, the Children's Action Plan. Yeah.
Children's Action Plan, okay. Now Shane, you used to train as a teacher and then you went into a larger, more demanding area called social services, is that?
Yeah, I think both areas are very demanding work when you're working with kids, but did initially train as a teacher and then moved into the social work profession. I've been social worker for the last 12 years now. Yeah.
Okay, and what's your role in the social work department?
So within the Children's Action Plan, my role is workforce lead. So that's a role that primarily sits around workforce development, kind of understanding how we think about kids and work with vulnerable kids and bridging that gap to how we our actions around kids, so the way that we work with them. Yeah.
Okay, and so what are you hoping to achieve with the Children's Action Plan here?
Yeah, I think we, as a country, we all agree that kids and families should thrive, belong and achieve, but we've become increasingly aware of some of the really terrible stats that we have around kids, particularly when we compare ourselves to other Western nations. So stats around abuse, harm for kids, and the number of children that we lose every year through the actions of people who should be caring for them.
I see, okay.
So in 2012, the government commissioned what's known as a green paper, so some submissions from the community about how they would like to respond, how they would like to take better care of their kids and their families. And from that we identified some pretty key things that have that we can put into action to really support our kids and families. Yeah.
Okay, and what were some of those things that they identified?
So the key things really were around how do we identify these kids, and when we do identify these families, what is it that we're doing to support them?
Right.
Making sure that the kids are being supported in the right way, at the right time, and what suits them. Making sure that our workforce is safe and competent, so that when we do identify vulnerable children and families, we know what to do to support them best. Taking a really child-centred approach, and really increasing recognition that every adult has a responsibility to take care of the kids.
Okay,
yeah.
So it's quite a wide thing that you're talking about when you're involving these children. It's not just like it's a health practitioner role as well as parents and things like that.
Yeah.
Yeah.
So there's been some of the things that have come out of the Children's Action Plan is the formation of a Vulnerable Children's Board.
Right.
So that's 5 key ministries who work with kids and families joining together to take a collaborative approach to the outcomes of vulnerable kids and families. So those ministries are police, education, health, social development, and justice and corrections.
Okay,
Yeah.
so very, very wide.
Yeah.
Okay, all right. And you were talking to me before about this culture shift.
Yeah. So we have traditional ways of working, and often those ways of working are what suits a very service-driven model. So I deliver this particular thing in a particular way.
Yeah.
And what we're asking the workforce to do is to think about delivering their service in a way that is really child-centred and actually suits where the child's needs are at, and in a way where they can gather evidence which shows not how many I delivered, but how well I delivered it. What difference did I actually make?
Okay.
Yeah.
And how would you go about? So I can imagine it'd be different for each child.
Sure.
Is it quite a personalised approach? Or is
Yeah, it is. So we have a lead professional workforce. So there's 10 children's teams around the country. Children's team is the kind of practice approach to working with these kids, and it's an intensive collaborative effort led by a lead professional with the support of a network that sits around a family. It's driven by the family's aspirations, what they want for themselves, and what they see as their strengths and areas that they want to continue to work on. So we receive referrals from across the sector. We look at the unique needs of those kids. We share information with each other. We collaborate, and we take a really child-centred approach to what have we got in this picture, what else do we need to add, and how are we going to work together to achieve that.
Okay. And is this a nationwide thing?
Yeah, it is. The Children's Action Plan, aspects of it cover the entire children's workforce, which is over 300,000 people, particularly around the safety and competence of our workforce. There are 10 children's teams sites across the country, 8 in the North Island and 2 in the South Island.
Okay.
Yeah.
Quite a difference between the two islands, I must say.
Yeah, it's there's a range of factors as to why children's team might be available in that particular community, population-based,
Of course.
things like that.
Yeah. Okay. So, can anyone, if anyone's interested in your Children's Action Plan, how do they become involved with it?
Yeah. So, a good starting point would be to have a look at our website, childrensactionplan.govt.nz. If you have a worry about a child, we have a vulnerable children's hub, so a phone line and an online portal where you can share that worry and get those supports in place for that family at a much sooner point than what we've traditionally done. So there's that opportunity to make those referrals, and then beyond that, if you're a professional working with a family,
I was going to ask about that.
if you're a professional working with a family and you are able to continue to contribute to that family's goals and their outcomes, a lead professional may make contact with you and say, hey, we really need you to join into this network. And what joining into that network means is that you're able to collaborate, share information, use some of the tools and resources that the children's team have to really make sure that those outcomes for kids are positive and helping them to really healthy lives.
Okay. Sounds really good what you're doing, and lots of hard work, and it sounds like it's going to be making quite a difference. Thank you, Shane, for coming in today and having a chat with us about the Vulnerable Children's Group.
Cheers.
And I wish you well for the talk you're going to be having on Sunday, is that
Sunday,
right?
yeah.
Yes, okay. Great, thank you.
Thank you.